was going to say in this speech. Today, and especially after Wednesday night, I'm not quite so sure. You see, I've been through all of this before. In the 1990s, I was Director of Public Affairs for the Metropolitan Medical Society of Greater Kansas City. That was during the time of President Clinton trying to attempt health care reform. Governor Mel Carnahan of Missouri trying to enact health care reform. So many trips to Washington, D.C., many trips to Jefferson City. And what's happening then, or what happened then, is happening now. And it comes down to this. Politics is a dirty, rotten, stinking business. The only equation that matters is whether you win or lose elections. Whether or not there's any public benefit that comes from your time in a state capital or a national capital, that's a side benefit. If we could take this debate out of the political arena, I think we would be able to do a lot better. But the fact is, it is in a political arena, and we need to move forward. So, what about the next 6 weeks? What's going to happen? Well, I think it comes down to a question of whether or not we trust the government or we trust the insurance industry to guarantee coverage for all Americans. President Obama wants the public option, which is a government-run health plan. The insurance industry opposes the public option, but in return, for a mandate to cover all Americans, they would drop the provisions that have been discredited, like denying coverage because of a pre-existing condition. That's a part of the debate that we need to pay attention to. Do we trust the government or do we trust the insurance industry to guarantee quality? Now, as long as I've been in medicine as a public relations professional for about 20 years, I've come to the conclusion that whenever it comes to quality, it's more looking at medicine as an art than as a science. Now, let's imagine that we're in an automobile accident and we end up going to the emergency room. And by luck of the draw, we will either draw Dr. A or Dr. B. Dr. A will quickly recognize that to treat your condition, it will take 15 steps. He's the type of doctor that at step 5 or 6, he will determine whether or not to continue, whether it's worthwhile to move forward or if it's a futile situation. Dr. B will always take every single of those 15 steps. And if he or she can find a step number 16 or a step number 17, they'll take it. Both are good doctors, both provide quality medicine. So whenever I hear about a government commission to determine what works in healthcare, that makes me a little bit nervous. And I'm reminded of a physician who told me, Lorell, I can practice perfect medicine, but still have a bad result. So pay attention to the idea and the issue of quality. Do we trust the government or do we trust the insurance industry to guarantee cutting costs? Well, the insurance industry knows how to do that in a private marketplace. And in a marketplace, there are winners and losers, and nobody wants to be a loser whenever it comes to healthcare. So we've established that we don't want that. And so we're trying to figure out how best to meet that goal. Government cuts costs by, well, wait a minute, government never cuts costs. Medicare, Medicaid going broke in less than a decade. And the recent example of the Cash for Clunkers program, it went from a $1 billion program to a $3 billion program in a week. There's no track record there for government to be able to cut costs and control costs. But it's on the table. So we need to keep that in mind and pay attention to it. So what should we do? Well, we should educate ourselves with sources that we trust. We should consider our values. And we should act accordingly. We should call our senators, we should call our member of Congress, and tell them what we want. Now, with all that, I throw out a challenge to all of us. Now, I know there are some people in this room, Karen Riley being one, who would gag at the thought of watching the O'Reilly Factor on Fox News. Yes. Then there are those who would gag at the thought us to do is watch both. Because by doing that, we will see the polar opposites of this debate. And then we have to determine where that middle ground is, where all of us can go to achieve the goals that we want. Because when it comes down to it, it's up to us. And then perhaps in years to come, 5 years, 10 years, our children, our grandchildren will be able to look back at the year 2009 and say, we finally did the right thing. Mr. Toastmaster.